Hi, thank you for your interest in this study. My name is Catherine Ardeleanu, and I'm a doctoral student at Drexel University in Philadelphia. And I'm going to be telling you about a study that my team and I did in which we interviewed queer and transgender autistic adults about their experiences and perceptions. And the reason that we chose to focus specifically on queer and transgender autistic adults is because, well, there hasn't been a lot of research done with this population. So what we did was called an exploratory study, meaning that since there hasn't been a lot of research in this area, we were simply exploring the perceptions of and experiences of queer and transgender autistic adults to start to develop a better understanding of this population. So we interviewed 65 people. And since this was an exploratory study, we asked interview questions about a wide range of topics, including like participants' childhoods and experiences growing up, their education, their experience with healthcare, relationships, all sorts of things. And when we analyzed the interview data, we noticed that a lot of participants talked about autism diagnosis and their autistic identity, including some people who self-identified as autistic without a formal diagnosis. So we got curious about this and decided to just look at the data from our interviews related to autism diagnosis and self-identifying as autistic. And we found a few key themes that emerged. First, many participants found that having a diagnosis was really validating for them, and it also helped them understand themselves. For many participants, they hadn't been diagnosed with autism as children, and yet as they were growing up, they always thought that they always felt different from their peers or felt like they processed things differently than their peers. And so having an autism diagnosis actually validated that experience and helped them understand themselves and how they related to others better. That being said, a lot of participants didn't have a formal autism diagnosis in our sample. And we found that participants described a lot of barriers to seeking or receiving a diagnosis. For some, navigating the healthcare system was way too difficult. For others, the process was too expensive to try to get a diagnosis. Some were afraid of the social stigma that having a formal diagnosis could bring, so they just decided against pursuing a diagnosis. And other participants told us that they didn't see the point or any benefit from getting a formal diagnosis, and that knowing that they were autistic based on their own self-identification was enough for them. Participants also talked about invalidation as a key theme related to their autistic identity. And this showed up either as a result of social stigma against autism in general, or invalidation that they experienced from other people who knew they were autistic and as a result didn't take them seriously. And this was especially true among participants' experiences with doctors and medical providers. Lots of participants faced invalidation from doctors who knew that they were autistic, particularly around doctors' impressions of participants' abilities to make their own medical decisions. Since we worked with queer and transgender autistic adults in this study, a lot of participants had sought gender-affirming care, like hormone replacement therapy, and had been denied this care because doctors believed that they couldn't make their own medical decisions. So what does this all mean? First, we need a lot more research on this population. Second, our team argues that since there are so many barriers that people can face to getting a formal diagnosis, autism research in general shouldn't require a formal diagnosis unless it's specifically necessary in order to answer the specific research question of the study. And lastly, there needs to be a lot more information generally and also education for medical providers on how queer and transgender autistic or on working with queer and transgender autistic adults in order to increase understanding and to address stigma against this population. Thanks for watching.